Good afternoon, and welcome to Advocacy for Mushroom Vape, a video series pertaining to the advocacy of vaping mushrooms. We are working on part 2 of Lion's Mane, so bear with me. This is therapeutic potential of erection or depressive disorder. I went through the abstract yesterday, and we ended up just doing that and playing. But so let me highlight a couple points from this abstract. Hericium arenaceus is also known as lion's mane mushroom, has been shown to have various health benefits including antioxidative, anti-diabetic, anti-cancer, anti-inflammatory, antimicrobial, anti-hyperglycemic, and hypolipidemic effects. It has been used to treat cognitive impairment, Parkinson's disease, and Alzheimer's disease. Bioactive compounds extracted from the mycelia and fruiting bodies of lion's mane has been found to promote the expression of neurotropic factors that are associated with cell proliferation, such as nerve growth factors. Although antidepressant effects of lion's mane have not been validated and compared to the conventional antidepressants based upon a neurotropic and neurogenic physiology of depression, lion's mane may be a potential alternative medicine for the treatment of depression. This article critically reviews the current literature on the potential benefits of lion's mane as a treatment for depressive disorder, as well as mechanism underlying the antidepressant-like activities. I know I read this the last time, but it's important. It's important for me to stress. It has been used to treat cognitive impairment, Parkinson's disease, and Alzheimer's disease. Right, so we already know. I mean, we've known for a long time that lion's mane is good for the brain. But what's my point? What's my purpose in discussing lion's mane? And because I'm trying to use all the reports for from the pulmonary system, the oxygen to blood. Well, right here, bioactive compounds extracted from mycelia and fruiting bodies, neurotropic factors, proliferation of nerve growth factors. Let's say you had a whooping cough as a child, and you damaged your lungs. Perhaps we can enhance the growth factors with this. Perhaps. Let's say other coughing situations, etc. This is a remedy, a healing type of mushroom, I would say. But okay, let's go on. I'm sorry. Okay, major depressive disorder, also known as depression, is a common neuropsychiatric disorder that affects more than 300 million people of all ages. 300 million people. That's a lot of mushroom advocacy for vaping. Okay, so the common signs and symptoms of depression include loss of interest in daily activities, difficulty concentrating and making decisions, fatigue, sleep problems, overeating or appetite loss, pessimism, hopelessness, persistent sadness, and restlessness. Untreated depression could lead to suicidal thoughts or suicide attempts. Suicide is the leading cause of death in young adults worldwide, and approximately 800,000 cases of suicide are reported annually. And these have sites. Okay. In the 1950s, pharmacotherapy has become the main treatment for depression since the introduction of the first generation of antidepressants, which are monoamine oxidase inhibitors, iprionazid, and tricyclic antidepressants, imidaframine, and have been on the market the longest. In the 80s, the second generation of antidepressants, including selective serotonin reuptake inhibitors, fluoxetine, sertraline, paroxetine, and selective serotonin non-adrenaline reuptake inhibitors, venlafaxine, duloxetine, desvenlafaxine, were introduced as a safer class of antidepressants. Other antidepressants prescribed less often include serotonin 5-HT2C receptor antagonists, olanzapine, alpha-2 blockers, and atipamezole and atipamezole, melatonin receptor antagonists, melatonin, and selective non-adrenaline dopamine reuptake inhibitors, norepinephrine. Although many types of antidepressant drugs are available, their overall efficacy is still barely satisfactory. Studies of antidepressants in adults with moderate or severe depressive disorder revealed that currently available antidepressants can only reach symptoms of depression in about 20% of patients. 20%. Well, I imagine that you go through the cycle of drugs the psychiatrist just gives you to the point where you find the one that's more suitable for you. Right? Furthermore, antidepressant medication often needs to be administered continuously for years to prevent relapse. Besides, more than 50% of antidepressant users reported they experience side effects, including headaches, dry mouth, anxiety, dizziness, weight gain, decreased interest in sex, as well as a loss of ability to have an orgasm or an erection. The side effects can also lead to failure in administration of antidepressants in depressive patients. And we go on to say, herbal medicine can be a cost-effective complementary and alternative medicine for the treatment of depressive disorders, generally with fewer side effects and limited comparative efficacy to conventional antidepressants, as well as it is well tolerated by depressive patients. Mushrooms are functional foods with high nutritional values and are great sources for novel therapeutic compounds. Lion's mane is a medicinal culinary mushroom widely found in East Asian countries and is commonly known as lion's mane mushroom. Yamabushitake, or monkey's head mushroom, has a long history as a medicine. Oh, okay, so it's also called monkey's head and Yamabushitake. It has been found to promote positive nerve and brain health. It has been great potential in treating neurological disorders as it contains neurotropic compounds that can pass through the blood-brain barrier. Bioactive compounds extracted from its fruiting body or mycelium have been demonstrated to possess antioxidant, anti-diabetic, anti-cancer, anti-inflammatory, antimicrobial, anti-hyperglycemic, and hypolipidemic properties. Moreover, lion's mane has been used to treat cognitive impairments, Alzheimer's disease, Parkinson's disease, ischemic stroke, and presbycusis. Recently, the present research on lion's mane has been focused on its antidepressant-like effects for the treatment of depressive disorder. 31, 32, and 33. What if I do this? 31 title is an enriched lion's mane mycelium produces antidepressant-like effects through modulating signals in mice. Let's go to 32. Erection erinaceus extract reduces anxiety and depressive behaviors by promoting hippocampal neurogenesis in the adult mouse brain. And effects of amicinone on serum levels of tumor necrosis, interleukin 10, and depression-like behavior in mice after lipopolysaccharide administration. Well, how interesting is that? Okay, so the aim of this review is to critically review the current literature on the potential antidepressant effects as a treatment for depressive disorder, as well as possible mechanisms underlying antidepressant responses. Okay, so this right here is the mycelium. This right here is the fruiting body, and that's fruiting body. Okay, so what's the pathophysiology of depression? Depression is a complex disorder, and its etiology is believed to be heterogeneous with many causes and contributing factors. The pathophysiology of depression is unclear, but is believed to involve neurodegeneration and neurobiological changes. The following section discusses the hypothesis of the pathophysiology of depression relating to the therapeutic potential of lion's mane. There's a monoamine hypothesis. Neurotropic and neurogenetic hypothesis. Neurotropic and hypothesis of depression involves the neuroplasticity and adaptation of the nervous system, and the inability of the nervous system to respond or adapt appropriately to adverse stimuli or stress resulting in depression. Antidepressant drugs that stimulate appropriate adaptive responses were able to alleviate the symptoms of depression. No, this isn't giving you drugs. This is vaping mushrooms. This is an advocacy for mushroom vape. You know, I mean, medicinal nutrition supplement. All right, so I imagine I'm going to link this to this page so you can read it yourself. There's a lot of words that are out of my ability to pronounce. Not intentionally. All right, I know it sounds like I'm wimping out. All right, let me try to read something. Antidepressant treatments that restored or increased BDNF levels. It's the brain-derived neurotrophic factor, BDNF. Were able to alleviate symptoms of depression. 51. And immunoreactivity in subjects treated with antidepressant medication. All right, so let's just write. Okay, so increased brain-derived neurotrophic factor expression level is known to induce several types of neuroplasticity, including synaptogenesis, adult neurogenesis, and neuronal maturation. BDNF functions by binding it to receptors, including tropomyosin receptor kinase, and pan-75 neurotrophin receptor, which is a low-affinity receptor. Then there's an inflammatory hypothesis. Depressive disorder is found to link with an increased expression of various central and peripheral pro-inflammatory cytokines, including tumor necrosis factor. Evidence from an in vivo study shows that the concentration was increased in rat model depression subject to chronic mild stress. Furthermore, animal models inflammation associated depression. So this just goes on to the background of it, right? Of what we've been doing to try to correct this pharmacologically, right? So Hereditary arenaceous amarylase depressive like behaviors. Preclinical studies. Therapeutic effects of lion's mane has widely studied in several neurological diseases. However, not many studies have investigated its use in mental disorders. This review summarizes the behavioral and physiological effects of different extracts in the studies of depression. Table 1, patented extraction. Well, my extraction is not patented yet. If you make a patent on it and then bust my balls, that's nasty of you. So don't do that to me. I showed you how to do it, mind you. What we want to do is we want to get this in the hands of everyone. We want to get this in the hands of everyone. That's a serious point. Look, not to say this like this, but if you have a friend, a mother, a father, a brother, a sister, a son or daughter, who is exhibiting depression and quite possibly thinks about the terminal aspect of it. My little girl. Let me see if I can get her picture on there for you. She's going around. She's so funny. You're a comedian. Alright, I'm going to set it out the door. Come on. You go say hi? Come on. She's so funny. She's a comedian. Here, I'll show you. She's a Belgian Malinois. We rescued her, from what we understand. Alright, well anyway, did you know that dogs can benefit from mushrooms? Alright. Yes, dogs can benefit from mushrooms. If you knew, if you care. Turkey tail, etc. Oh no, I got it backwards. Alright, sorry. Okay, let's go back to what we were doing a moment ago. Alright, hold on. Alright, so it's about 15 minutes. It's going to be 18 minutes and 15 seconds. But anyway, my point is mix them up. Have them try it. Have them try it. Okay, so 5 milligrams per kilogram of amlodipine. I guess we're gonna open a separate window now. Okay, so amicinone is a lion's-mane extract obtained from the fruity body through a patented process, which contains 5% of hydrococinine and 6% amlodipine. So I wonder if mine's getting it out. But amicinone, I suppose. It's right here. Forced swim and tail suspensions test. What is that? Oh, animal model. Listen to this. One interesting thing about mushrooms is that you don't need 2 weeks. Like most pharmaceuticals, you need 2 weeks to stabilize in your system. But mushrooms act immediately. So let's see if they say that. These results demonstrated antidepressant-like effects of amicinone in an animal model of LPS-induced inflammation depression, suggesting its neuroprotective effects against inflammation-associated depression. However, treatment of depression usually requires long-term administration of antidepressant, and acute treatment might not provide a long-term therapeutic effect, which might eventually trigger a recurrence. The experiments conducted by Yao et al. Could be improved by prolonging a study to examine the long-term antidepressant effects of amicinone, right? So you need to take whatever medication it is for 2 weeks in order to... Oh, thank you. Oh, thank you. All right, so she wants my attention. Okay, so hold on. Let's find out what she wants. When you're 2, I forget. All right, well, she's telling me it's enough time. I got 9 minutes, baby. Come on. She's stupid. All right, so she's a Belgian Malinois. They're intelligent. So they tell me they could jump over things. And we have ducks and chickens, and we have a low fence cordoning off the area. She ate my swizzle stick. Come on, quit eating my stuff. Go. So I give her a chew. Okay, so I know we're gonna have to do a part 3 on this. So anyway, let's see how far this goes. A recent study by Chui et al. 2018 investigated the effects of extracts of lion's mane enriched in arenosine. So what? Is arenosine as well? In an animal model of depression induced by repeated restraint stress. Well, guys, she's trying to get my attention. Come on, give me 8 minutes, honey. However, we did not detect any anxiolytic effect in the elevated plus maze, which contradicts the various findings by Rua et al. In 2018. One possible reason for this discrepancy is that the 2 studies used different extracts. Use the ethanolic. Alright, Chui used the ethanolic extract enriched with arenosine and A extracted from the mycelium, whereas Rua et al. Used ethanolic extract from the fruiting body. I'm using it from the fruiting body. So this may reduce anxiety. Is what they're saying. That's what I think they're saying. Okay, so Arisine A was reported to enhance nerve growth factor, and GF activity to promote neurite outgrowth and its therapeutic effect was validated in the central nervous system of rats. Maybe you look at the papers. All right. Clinical studies. We would like to do a clinical study, what do they call it? An observational study, please. Granted, if I have enough people to back it. Look at this. Their finding revealed that consumption of cookies containing 0.5 grams of fruit body powder alleviated symptoms of depression, anxiety, frustration, and palpitation. Which is my idea for the coffee shop confections, a mushroom confections. Look, 0.5 grams of fruit body powder in cookies. So we already figured out that, this is the Center for Epidemiological Studies. We already figured out that we can go as far as 10% of the powder to be flour, your general flour, or we decrease 100% flour down to 10% flour by adding mushroom pudding into the confections. Now, how interesting is that? In 2014, Anand Aga reported improvement in neurocognitive function after treatment with amylin tablets of standardized extract in an 86-year-old male patient with recurrent depressive disorder. However, mirtazapine and antidepressant drug was also administered together with it. So we're not really sure. But I mean, it's all hope. Recently, clinical study examined the effects of interventions on anxiety, depression, binge eating, and sleep disorders. 77 volunteers in the body mass index, equal or greater than 25 kilograms squared, mass squared, I guess. An average age of 53. The study recruited overweight or obese participants who were positive for one or more administered tests, including Zung's depression self-assessment scale, Zung's anxiety self-assessment scale, symptom checklist 90, and binge eating scale BES. Participants received 3 capsules containing 80% mycelium extract, 20% fruity body extract for 8 weeks. And they found that significantly reduced depression, anxiety, as well as improvement of sleep disorders after 8 weeks of oral administration. However, it's not clear whether these behavioral results may be partly due to placebo effect from consuming a capsule. The experimental design of this study could have been improved by including placebo capsules in the control group. Right, so like my rush to read this paper to you is the same thing. Look, I want so badly to say this is a validation for vaping a mushroom. Heracinones are aromatic compounds extracted from the fruiting body. Look at that. 1/6 of my formula is lion's mane. So part of what you're smelling when I breathe this will be lion's mane. All right, so I got like 2 minutes. Okay, so what it looks like, chemically it looks like this, and then adenosine looks like that, and then that's next, adenosine. So when we get back, we're going to go start from adenosines, 4.2, and then novel compounds afterwards. All right, well, thank you very much for your time. I appreciate gaining the don't eat that. I'll get in trouble. All right, thank you guys. Have a beautiful day. This concludes part 2, segment 1 of Lion's Mane. Thank you. Have a beautiful day.